Pleased to bring you Dr. Edward Bartlett, President of the International Council for Men and Boys, and an unrelenting driving force behind all the progress we've made in the last decade.
Thank you, Rebecca. So it is generally regarded around the world that there is a right to life, and this is signified in the Universal Declaration of Human Rights. It's a broad principle that if a person is not alive, obviously all the other rights simply don't exist because the person is no longer alive. So the right to life is the most important right that anybody can have. Next slide. So the lifespan gender gap is a persistent and global problem. This table in front of you right now, so on the bottom is life expectancy for men, and on the left side is displayed life expectancy for women. So if lifespans were identical in all countries, it would be a perfectly straight line. There would be no variation away from that line, especially above or below that straight line. Well, you can see that in fact that there is significant variation away from that line. If you look carefully in the middle, you might see Russia, and Russia, the 10-year lifespan gender gap. Ukraine also has a 10-year lifespan gender gap. The average around the world is 5 years. On the other hand, in certain countries like Cuba, their lifespan gender gap is only 2 to 3 years. So you can see that this is a very important, and it's a global problem that we're dealing with. So just to look at this in the United States, the states that have a blue color indicates these are states in which the lifespan gender gap is less than 5 years. The states that have purple, which are Nevada, Illinois, and Ohio, their lifespan gender gap is 5 years exactly. And then the remaining red states, the lifespan gender gap is greater than 5 years. So you can see this is, first of all, this is a national problem, but it does vary from state to state for reasons we don't fully understand. So let's ask ourselves, what is being done to address the lifespan gender gap? We'll first look globally, and then we'll look at the United States. So to answer this question, we first look at the World Health Organization, which ostensibly is designed to address the health concerns of all persons, all citizens around the world. So this was a screenshot. First of all, you can do a search for health topics and then look specifically at women's health. So that's what you can see on the screen in front of you. And actually, this is just the first part of a very lengthy, they have numerous reports, they have fact sheets and so forth. I didn't want to bore you with the entire screenshot, but you can see there's a substantial attention by WHO to women's health. Now look at the bottom of the same screen. If you would scroll down a little bit. So then we did a screenshot looking specifically at men's health. So you can see they have information on medicines, meningitis, and then logically, men's health would follow right after meningitis. You can see there is nothing there that addresses the men's health as far as the health topics on the World Health Organization. This is a rather disturbing and stunning, really a stunning disparity. Going to the next slide. What about in the United States? Well, I used to work at the Department of Health and Human Services for 17 years. And at the DHHS, currently there are 7 offices for women's health. And they're in different units or different parts of DHHS. You can see they are all listed here. They all have websites, et cetera, et cetera. But now let's scroll down a little bit more. What about offices of men's health? Surprise, surprise, there is simply 0 offices for men's health. This is a stunning absence about attention to the health of men. So going to the next slide, let's ask the question, well, how have feminists explain this rather disturbing disparity. Well, since the 1990s, feminists have made the claim that women were routinely excluded from medical research. I've included 3 quotes right here. There was an editorial in the leading New England Journal of Medicine, quote, "There is little doubt that women have been systematically excluded as subjects for study. It is not surprising that most clinical trials have been heavily, if not exclusively, weighted towards men." Okay, that's a pretty strong statement. Looking at the last quote there, "The exclusion of some women from clinical studies may sometimes be valid, but not all the women all the time." That's that's a very strong statement. Let's probe to find out if those statements have any truth to them. So this was an article, and actually I was the author of this article. It was published in a leading epidemiology journal in 2001. And part of the article actually looks at Medline, which is a database for medical research. And I looked just at the number of hits. In other words, the number of times Medline listed a study, and you can see for about 10 different conditions listed on the left side of the page. The number of studies that included men in those studies is the second column. And you can see the total there is over 13,000 studies. And this is over a 35-year period. So we're looking at a long period of time. And then the third column is for the number of studies with females that included females. Well, look, surprise, surprise, not only are there a lot of studies that included women, the number of those studies actually exceed the number of studies that include men. Maybe you're asking why. Well, a lot of the explanation is cancer research has been heavily weighted in favor of women, literally since the beginning that NIH began to do research, the National Institutes of Health. So this is obviously an absolute, completely refutes the claim that women were routinely excluded from medical research. But this narrative has been repeated frequently, and I would say constantly, over the last 35 years. So now there's sort of this sense of, oh, well, we have to make it up. We have to compensate for this alleged exclusion of women. So the most recent analysis looks at the actual overall funding for men's health versus women's health. DHHS funding for men's health, $963 million compared to $5 billion for women's health. And partly that's the cancer disparity, but also other areas. So it's a 5-to-1 margin of funding for sex-specific research. So we have to, look at the conclusion. We have to say that there has been a longstanding neglect of men's health by the World Health Organization, by the Department of Health and Human Services, and in other countries as well that we haven't discussed right now. But I would argue that this exclusion represents a major ethical and a moral stain on the reputations of these groups. This stark imbalance in sex-specific health policies is reminiscent of totalitarian societies in which policies are based not on data, not on science, but rather on ideology. These are the statements in the New York Declaration for Men and Boys. I'm not going to read the whole thing, but you can see that the last bullet says we need to establish offices for men's health to address the understudied problems that affect the health of men and boys. So that concludes my comments, and be happy to answer any questions at the end of the conclusion of the press conference. Thank you very much.
Great, Ed. Thanks. It's always so interesting, if not shocking sometimes, to actually hear the data and facts on these things when we're so used to hearing the narratives. It's hard to get through your head sometimes. So those facts really help.